In 2005, the Supreme Court of Canada ruling confirmed what everyone knew. As Chief Justice McLaughlin wrote herself, access to a waiting list is not access to health care. Making patients suffer or even die on wait lists without an alternative is not just a betrayal of the unwritten contract between the state and the taxpayer. The court said it is a violation of their basic human right to security of the person. We promised to work with the provinces to develop patient wait times guarantees. We vowed that they would be based on the recommendations of the bipartisan Senate committee, co-chaired by Liberal Michael Kirby and Conservative Marjorie LeBreton. I believe Dr. Keon also had a hand in that as well. We said such guarantees must ensure that patients receive treatment for a publicly insured service within a medically acceptable maximum time. And we said they must have the option of receiving treatment outside their home region if it's not available locally. As soon as our cabinet was sworn into office, Canada's new Minister of Health, Tony Clement, launched negotiations with the provinces and territories. None of my ministers had a tougher assignment. I'm sure I don't have to tell anyone here how complex the issue of wait times is, and if you multiply it by 13, you get some sense of Tony's challenge. But as the former Minister of Health for Ontario, he knew many of the provincial players and understood the issues from their perspective. In short, there was no one better qualified for the job. Minister Clement has succeeded in his mission. All 13 provinces and territories have now committed to providing the first patient wait times guarantees. We know it was going to take time, persistence, and constructive relationships with the provinces and territories to get the job done. We vowed to end the practice of federal grandstanding as a defender of the Canada Health Act while doing nothing to address the spiraling wait times crisis, or worse, while simply cutting transfers to the provinces. We promised to respect our constitutionally enshrined areas of jurisdiction and to work collaboratively towards our common goals. These have been the guiding principles in our drive thus far to provide Canadians with the timely medical treatment they deserve. We introduced 2 wait times projects to improve diabetes care in First Nations communities, and we implemented a pilot project to help on-reserve Aboriginal women get timely, quality prenatal care. Well, these initiatives were for Canadians who relied directly on Ottawa for health care. Our government never lost sight of the ultimate goal: more timely health care for all Canadians. The government has, for example, established the Canadian Partnership Against Cancer, a nonprofit organization whose express purpose is to implement a national cancer control strategy. We've partnered with the Rick Hansen Foundation to improve the quality of life for 40,000 Canadians living with spinal cord injuries. We've taken proactive action against cancer of the cervix, the second most common cancer in Canadian women, by providing support of a national HPV vaccination program. We concluded a compensation package for all victims of hepatitis C. We set aside money for a Canadian Mental Health Commission, an independent body to be led by former Senator Kirby that will be a catalyst for national action on the prevention and treatment of mental illness. We launched a national pediatric wait times pilot project that will ultimately lead to a surgical wait time guarantee for all Canadian children. We increased funding to the Canadian Institute of Health Information, one of Canada's premier sources of accurate, timely, and comparable health information. When a government makes an investment in the health of people, it is making an investment in the country's future. And the patient wait times guarantees that we've negotiated with the provinces and territories mark yet another step forward in our government's commitment to building a stronger, safer, better Canada for all of us. So thank you for your time. Good luck in the conference. Merci beaucoup. Et à la prochaine.
You promised 5 or 6 key areas. I'm not quite sure. 6 are listed today. You're ticking this off as promises kept, obviously, but how can it be, given that it's only a commitment for wait time guarantees in one area, how can you call it anything more than 1/6 of a promise kept?
Well, I think the important thing is how the provinces will work together and the territories will work together will mean that this will have an impact throughout the health care system. I'll give you one example. Manitoba has chosen a guarantee on radiation therapy. Saskatchewan has chosen a guarantee on cardiac. And they are developing agreements between those two provinces so that they can help each other out in cases where the guarantee cannot be met in their chosen area in their province. It could be met in the province next door. So really what you're starting to see is a whole healthcare network being created for healthcare guarantees, which expands the impact of this truly nationwide. So that's the first thing I'd say. The second thing I'd say is, beware the politician who says that healthcare guarantees can be done with flicking on a light switch and you're going to get 100% guarantees for 100% of the time tomorrow. The experts in the other room will tell you that can't be done. That isn't the way our healthcare system works. What we've done is we've started down the road. We have made tangible progress for the people of Canada on the issues that they care about when it comes to wait times, and this will in turn engender future successes in our healthcare system. There's no doubt about it. And so the guarantee is that 100% of the patients will be able to obtain their care either in their present jurisdiction, their local hospital, let's say, within the 6-week period. If that is not possible, then the guarantee says there is recourse available to the patient. That recourse may be another doctor. It may be another procedure which is equally as effective. It may be having the procedure done in the next health area, the next health authority area next door. It may be somewhere else in the province. It may be somewhere else in the country. So really there's a hierarchy of options available to the patient that will kick in systematically if the guarantee is at risk at not being met. The other thing, if I can just sort of paint you a picture of how this can be revolutionary for the healthcare system. With the application of health records and information technology, better management, and having the health human resources in place, what it means is we can start to track patients in real time through their healthcare journey. And we will be able to know that the patient is getting the care that they need from the health professionals that they need throughout each stage of the journey in the healthcare system. And we will be able to know if that is not the case and intervene so that it will be the case in the future. So this is this is the way our healthcare system should be run in the 21st century. We are applying our knowledge and our financial resources to make it the case, and that will in turn, I believe, mean that this will be the gold standard, if you will, for the delivery of healthcare in Canada.
Minister, the promise has been kept. He avoided the phrase of actually explicitly saying this promise has been kept. The original wording in your blue book last year or the year before in November and December was that there would be a medical wait times guarantee in essential services by the end of 2006. You're now talking about 2010 would be when it would come into effect.
I don't have the exact wording of that. I know the exact wording in the throne speech, which was to work with the provinces and territories to establish patient wait time guarantees. We have been successful. I think we're meeting the expectations of Canadians. Canadians know that politicians who say they can fix the healthcare system tomorrow are snake oil salesmen. They know that. So they know that this is a sophisticated area where quite frankly, politicians who promise too much and force the issue might do more harm than good in the healthcare system. We're taking an approach which I think is methodical. I think it's science-based. I think it works on cooperation and collaboration, and I think it will be successful. And that's what Canadians expect of us.